Hi, everybody. My name is Dr. Heath McAllister, and today we are going to talk about exosomes and how they may be used to treat and heal long COVID. Obviously, at this point, a lot of people have known or have experienced long COVID, known someone that's had long COVID, and all the difficult symptoms that come along with that. And it's it can be really tricky to treat. I've had a lot of patients come through my office having tried a whole bunch of different treatments, everything from ADHD drugs to nicotine and so forth, lots of different theories on how to treat this. And fortunately, exosomes seem to be a very promising treatment for long COVID and other long lasting viral infections. So let me pull up my PowerPoint here. All right. Okay, therapeutic exosomes and long COVID. Dr. Heath McAllister, that is me. First of all, let's go into a little bit about the background of what exosomes are, since this still really is not a household name. Exosomes are considered to be tiny extracellular vesicles. So basically, they're little packets of information that are budded off from a cell. So they're a little piece of microRNA or different types of messenger RNA that are then encapsulated in a little piece of cell membrane. Those little cell membrane are these little packet signalers that then go to neighboring cells, deliver that payload, and then those instructions tell the neighboring cells how to respond to the environment in an appropriate way. So they deliver lipids, proteins, regulatory RNA, and it's a way of facilitated communication between cells. Now, the quality of the exosome is the paramount thing. What are the messages contained in those little vesicles, and what are they stimulating those neighboring cells to do? So typically most therapeutic exosomes are derived from mesenchymal stem cells. So those are the stem cells that are found in, say, placental tissue. You can also pull them out of your own fat tissue. They do extract some exosomes from bone marrow. I will tell you that having been in this business for a long time and having tried a lot of different types of exosomes and knowing about stem cell treatments, my preferred is from mesenchymal stem cells from placental tissue. The reason I say that is that those are beginning of life stem cells. They have the most potency, the most ability to become anything, and therefore the exosomes they produce have the highest therapeutic impact, in my personal opinion. So placental umbilical sources, that's what I feel like are the best. They're all purified, pre-screened. They are cell-free, which is a really important distinction between that versus other treatments that are out there, like a stem cell treatment, which does confer some kind of risk by having cells included. So, how do they travel in the body? Well, if you do it as a therapeutic infusion, and just to back up, you can use exosomes in a variety of ways. You can use them topically, right? Microneedling treatments like the vampire facial, but using exosomes to embed them into the dermal layer to soften fine lines and wrinkles and stimulate collagen induction. That is a topical treatment. Exosomes can also be injected into joints. I've had some great success treating shoulders and hips and ankles and really getting a lot of healing in those specific areas. However, for something like long COVID, we really consider an infusion is going to distribute the exosomes most widely around the body. So you give the infusion through an IV, they enter into circulation, they migrate toward those areas of inflammation, which does tend to happen. We do see their preferential impacts on problem areas. So in the case of long COVID, there are many different potential sites that we want to intervene in. And then they're delivering those healing signals to those stressed out, inflamed cells. So, what do exosomes reliably do? So, they calm excessive inflammation. That is one thing that's very, very well researched. The exosomes are wonderful at tamping down excessive inflammation and excessive immune system response. So, they reduce pro-inflammatory signaling. That's great because, I mean, these kind of dovetail with one another. And they encourage resolution of issues rather than suppressing the issue. There's a lot of therapies that exist out there that really are suppressive. Steroids would be a treatment that's innately suppressive, or biologic drugs like TNF alpha inhibitors. Those suppress segments of the immune system, whereas exosomes seem to really have a balancing effect on the immune system, on inflammation, and on cell regeneration. So they really do balance the immune system by a variety of ways. They support regulatory pathways. They reduce autoimmune-like activity when your body breaks down the ability to differentiate self versus non-self. That is when the body can attack itself and produce tremendous amount of inflammation and damage on certain organs, and restoring healthy immune communication for all the cells in the body. So that's really essential for balancing the immune system. Exosomes really engender tissue repair, so stimulating cellular repair pathways, supporting mitochondrial function, which is so important. A lot of times, people that have long COVID, one of their symptoms is just extreme exhaustion. Exhaustion from going up a flight of stairs, waking up and feeling like you didn't sleep at all. A lot of times, we think about that as foundationally a deficiency in the mitochondria to produce enough energy. The packet of energy that we use is ATP. Mitochondria are the powerhouses of the body. So if your powerhouses are offline, let's say the power plant in the neighborhood's down, for the whole city. Well, nobody's going to be watching Netflix. Nobody's going to be working their blender, right? You need that energy, that vital energy to work all of the different functions of your body. So if you can repair the mitochondria, the powerhouses, the generators of ATP, then that is a really foundational benefit of having an exosome treatment. And then encouraging regeneration of damaged tissues. So something like COVID, we know some of the symptoms involve like lots of lung inflammation. And a lot of people after having had COVID, one of the symptoms that lasts is really a shortness of breath, a decreased lung capacity. So if you can really repair those end organ tissues, the lung, the pneumocytes and so forth, that's such a huge boon to long COVID patients. So generally, these are the symptoms we think about for long COVID. Chronic fatigue, big one right there, right? So you're just exhausted. Brain fog, you just can't think right, right? You're not clear-headed. That dovetails also with just having low energy. Anyone who has missed a night of sleep knows what it's like to just not operate with full energy and your brain doesn't function well. Okay, so these people have tremendous amounts of brain fog. There's our shortness of breath. Okay. So these are the main symptoms we think about for long COVID, and there's plenty of other ones, but these are the top tier ones that we look to try and heal with any kind of treatment that's addressing long COVID. And this doesn't just apply for long COVID because there's lots of other viral infections that may mimic this same thing. You have everything from Epstein-Barr virus, infectious mononucleosis, cytomegalovirus. There's, human herpes virus variants that can potentially cause these type of symptoms. So this by no means is limited to just healing COVID, but COVID really became such a pandemic, and so many people ended up suffering from these long COVID symptoms after. So there's possible antiviral effects from the exosomes themselves, which is great because if, let's say, someone does have a continued viral load, then what do you do about that? Well, um, carrying antiviral signaling molecules, wonderful, some direct antiviral effect, helping cells manage viral remnants. So a virus is, a little kind of glycoprotein coat with a DNA and RNA inside. And if those components are still hanging around, they're really irritating to your tissues. So to help macrophages and certain immune cells engulf those and destroy them. And then overall reducing chronic inflammatory overreaction or immune system overreaction. A lot of the times the symptoms we see from COVID are not the virus itself, but our body's response to that virus and the spike proteins and so forth. That extreme inflammation is really a secondary product of our body's response. So there have been some studies. So if you want to know, is there science behind this? Yes, there is. So there was a 2024 study, so really not that long ago, a case series of 10 long COVID patients. They received 2 IV doses of bone marrow derived mesenchymal stem cell exosomes. So even this study, okay, this is not using even what I consider to be the top of the top, the creme de la creme exosomes. Even this, these 2 infusions, 1 week apart and followed for 6 months. What did they find? Statistical improvements on outcomes like quality of life, fatigue, pain, stress-related symptoms, Those benefits were seen as early as 6 weeks and sustained for 6 months. So clearly, there was some big regulatory shifts, some big sea change in physiology that happened from these two IV events. And again, this is using just the bone marrow derived. So this isn't even the best of the best, but already really encouraging research here. And then there was another peer-reviewed study where they used amniotic fluid-derived exosome formulation and in long COVID hauler, where there was major respiratory improvements and no major safety concerns at all. Also, with this one, no serious adverse events. And that's something I'd like to highlight about exosomes. Since they're acellular, really, they don't contain cells. They are tiny, tiny signaling molecules. So that has several benefits. One, they can diffuse anywhere throughout the body. They can go to the brain, they can go to the kidneys, the liver, wherever they need to go, they can go because they're so small, they're not excluded by certain tissue barriers. The other thing is that since they're not cells, they don't have cell identifiers on them. Most of our cells, all mammalian cells, have a system of a name tag essentially called MHC, class 1 and class 2, that are on all of our cells that say, I am Dr. McAllister cells and you are your cells. And those cells don't play well together unless you suppress the immune system. That's why if someone receives an organ transplant, they have to be on immunosuppressive drugs, or else their body will view that organ as foreign and attack it. So if you receive foreign cells from a placenta or cord, your body will catch on that they are not your cells and destroy them. Sometimes when those stem cell treatments are done, those products also can be contaminated with white blood cells, and your body will have a very strong reaction to foreign white blood cells. So that's why, for me, exosomes are such a clean, pure product. They deliver the payload, they deliver the instructions like they're supposed to. There's no biologic white noise in the system to confound the area. The safety profile is so high. In terms of ongoing research, there are many other registered studies looking at inhaled exosomes for that post-COVID chronic cough and respiratory issues. Considering the lung inflammation is such a primary reason why people suffered such mortality during COVID, that is such a target for this COVID-19 virus. So finding substances that can really calm that inflammation and modulate the immune response there and rebuild the tissues afterward is really key to having great success with long COVID. So, as a path forward to consider, these exosome treatments calm inflammation, they restore immune balance, they support tissue repair, and they're really a promising option for those still suffering even after infection and potentially even during infection for those antiviral effects. For anyone that's interested in actually having a personalized exosome discovery session with me to see if exosomes could be a great option for you, this is how you contact me. I give 30-minute complimentary exosome discovery sessions. There's no obligation to move forward with the treatment. And if you do want to move forward with the treatment, we can connect you with that. I appreciate you all paying attention. I hope this has been something of value for you, and I hope you all have a lovely day.